Um, Good morning, good afternoon. I'm based in the UK, so therefore at the moment, I'm saying good morning. I'm Dr. Olga Zayt, and very well welcome to the webinar co-organized by HKU RIICH and IC4CH, Speaking Our Minds, Studies of Language, Mental Health and Stigma. It's my great pleasure and honor to invite Professor Diana Slade, who is a professor of applied linguistics at Australian National University, and also the director of the NEU Institute for Communication and Healthcare, to open our webinar. Welcome, Diana.
Thank you very much, Olga, and welcome to all the participants and the speakers to this beautifully prepared webinar on Speaking Our Minds, Studies of Language, Mental Health and Stigma. I know that Olga just said that, but as a reminder yet again why you're here. It's organised and hosted by the Research and Impact Initiative on Communication in Healthcare at the University of Hong Kong, known as RIICH, or RICCH. I'm not sure if you say it as an acronym, Olga, but let's call it RIICH. The convener and moderator for today's webinar is Olga Zayt, who is the Hong Kong U RIICH Director and from the School of English at Hong Kong U, and a marvellous and wonderful colleague. These webinars take place quarterly, as well as our annual International Symposium for Communication and Healthcare. I'm going to give a plug for our next one in a moment. They're all part of our activities of our recently established International Consortium for Communication in Healthcare, which we call IC4CH, so International Consortium for Communication in Healthcare. The international partners, consortium partners, are University College London, Lancaster University, Hong Kong University, Nanyang Technological University in Singapore, and Queensland University of Technology. We have an affiliate member, Dr. Beth Ryder, who is part of this webinar. Well, she's certainly participating at Harvard University, and the hope is they'll become partners within the next 12 months. What the International Consortium is about is it's an international, interdisciplinary and interprofessional collaborative that really the aim was to unite leading research centres in the field of healthcare communication. Its mission is to conduct evidence-based research that will lead to a far greater understanding of the role of communication in a wider range of healthcare contexts. This webinar's timing is not accidental. It coincides with the World's Mental Health Day that is celebrated internationally. It's going to present cutting-edge sociolinguistic research on mental health and how people communicate about and make sense of their mental health experiences. It's a wonderful participation rate. There's over 160 people from many countries around the world. And so I congratulate the organisers. I really look forward to hearing the speakers' presentations. I'll now hand over to Olga to introduce the speakers.
Thank you very much, Diana, for such a warm welcome. So just to reiterate a few things, so our research group at Hong Kong U is called Hong Kong U RIICH, and mental health is one of our priority themes, research themes. So the presentations today will highlight some of the ongoing projects on mental health of graduates who are transitioning to the workforce during the pandemic and after the pandemic, mental health ambassadors, that is people with lived experiences and their participation in destigmatization campaign, media representations of mental health of end-of-life care workers, and mental health of working mothers. So as you can see, we focus on mental health as one of the vital societal issues, but also on some vulnerable demographic groups. You can learn more about the work of RIICH by visiting our website, but also joining us on Twitter or following us on Twitter. The order of presentations in today's webinar is as follows. So Dr. Zoe Fortune will start. Then it will be followed by the talk by Professor Sylvia Jaworski, Stefan Inge, David Edmonds, and then I'll present on working mothers. We're very grateful to our discussant, Adil Tiang, who is Mind Hong Kong Anti-Stigma Lead Clinical Advisor. Adil comes from clinical background. She is a very experienced pediatric nurse practitioner, and she has done a lot of work and research in pediatric and adolescent mental health care. Thank you very much, Adil. And without further ado, I would like to invite the first presenter, Dr. Zoe Fortune. So just a few words about Zoe, and we are very, very lucky to have her as part of our team. Zoe is the leader of our HKU RIICH Research Cluster, Mental Health and Communication. She holds a PhD in Health Services Research from King's College London. She also holds a master's degree in counselling from Monash University in Australia. She's the founding CEO of City Mental Health Alliance, a non-for-profit organization that focuses on workplace mental health, and she now serves on their advisory board. She's published extensively in both academic and wide media outlets, and she also led large-scale research programs across multiple countries for work in healthcare, modern slavery, and international development. Welcome, Zoe.
Thank you very much, Olga. Lovely to see you all. And yes, thank you for that little bit of an embarrassing introduction. Let me, first of all, share my screen so we can get going. We are on a very tight time limit today, so I will be rattling through this presentation. Hopefully you can all hear me okay. So I'm going to be speaking about our new project funded by the Research Grants Committee Collaborative Research Fund here in Hong Kong. And I would just also, first of all, like to say thank you very much to our very large interdisciplinary project team and collaborators at both the University of Hong Kong, but also more globally around the world. We have a team from across psychology, sociolinguistics, and other academic studies as well. So I'm delighted to be here on behalf of the team. So I'm going to be talking a little bit about a new project that we have running. But before I begin, a little bit of background as to where this project came about. So what we know is that graduate transitions from the university to the workforce can be a particularly difficult time. And we know that graduates might be a particularly vulnerable demographic of young adults. We have job-seeking challenges, we have prolonged periods of unemployment, difficulty adjusting to workplace expectations, and those expectations are constantly changing, particularly as a result of the pandemic as well. So when you add in COVID-19, which we've all been through, we know that this has resulted in reduced unemployment, increased expectations, and it's also had an impact on mental health globally for everyone, and also for Hong Kong students as well. And it has broader societal issues and concerns. So this is a real issue that speaks to the heart of individuals as well as the communities, as well as relating to economic concerns as well. So with this new project, what we are hoping to find out is, well, actually, what are the current support offered by the universities in Hong Kong to enable those transitions to take place? What's happening currently, and what's changed as a result of the pandemic as well, the new work orders? What are the most appropriate ways of preparing graduates during transition times? Do they feel prepared now? What needs to change? What are their mental health and well-being needs, and how can we best support them at workplaces, at universities, and at home as well? And how could those experiences be usefully applied to facilitate successful careers and future transitions as well? So the project, we are adopting very much a mixed methods approach, and we have quantitative and qualitative components. We've started by piloting surveys and interview guides, and we will be conducting interviews and surveys with universities, with students, graduates, and those who have just graduated and now in the workforce. And also we will be speaking with workplaces, that's human resource teams, managers, and anyone involved in recruitment as well. And we'll be doing surveys and interviews all the way through. We have an interdisciplinary focus, as I said, and the idea that we really want to focus on is on practical recommendations and how we can best support people going forward in the future, as well as obviously our academic output. So I'm going to start with just a little brief highlight of some of the findings from a small component of our survey. So we have a few findings to present to you today, and the numbers are small, but I'm going to present on our survey with students, graduates, and employees. I'm going to use the term students for brevity, and that's the cohorts who have either left university or started university during the crisis time, so 2020 through to 2023 as well. That's these people here. So what we have in our survey is we have a range of very well validated measures, as well as some measures that we've created specifically for the project. And you can see that we've got measures of well-being and mental health in there. We also have measures specifically examining skills and the way that students are adapting in their attitudes towards the job market as well. We're asking a little bit about mental health, skill preparation, and we also want to be able to follow up with some of the students as well. At the moment, this survey is in English, but we are going to be translating it to reach a wider audience as well, and to ensure that we can get better representation across our cohorts. So some initial results, as I said, we have just over 200 responses so far. And what we will be doing is sharing results as we come through on the project as well. But we wanted to share a little bit of the results here today because they are really relevant to informing how we then go and do our further explorations and our further qualitative research. So we've got a fairly even split amongst undergraduates, postgraduates, and those who are in employment, which is really great so far. Nearly 40% experienced mental health problems, which, to be honest with you, is not surprising and very much fits with the literature. In actual fact, that might be a little bit low compared to some of the literature that's been coming out. And we also, what's interesting here is that 18% of the 76% say COVID has affected their plans, so that they've changed their studying plans. So that's something that we want to investigate a little bit further, because that has real economic, societal impact as well as individual impact as well. So looking at the mental health results as well. So we've taken these from the DAS, which is a very well validated measure of depression, anxiety, and stress. I'll present you with a few numbers, so don't get too worried about focusing on the numbers, just focus on the numbers in red. What I wanted to highlight here is that we are seeing that in this small group of participants so far, around 40% are reporting somewhere between moderate and extremely severe levels of depression. 54% are experiencing moderate to extremely severe levels of anxiety. And again, stress seems to be particularly high in this cohort. Maybe not unexpected, but it's definitely a cause for concern and something that we want to understand how we can best support this cohort of young people. And that's also borne out in some of the wellbeing scores that we are looking at as well. So again, the WHO Factor 5 is a very well validated measure. It's been used in multiple countries from the World Health Organization. And it's a very simple measure of psychological well-being taken from 5 questions. So a score of 49 out of 100, what does that actually mean? Well, we've got great variance. We've got some people who are scoring 8, which is very concerning, and some people who are scoring 92. So we need to look further into these findings. But just to give you an idea, Denmark has an average score of 70, and 50 has been recommended as a clinical cutoff score for further depression screening. So what that says to me is that we are seeing poor levels of well-being across this population, and we need to investigate why. We also ask people, how confident do you feel you have someone you can talk to about your mental health? First of all, let's look at in your life. And that was moderately or extremely around 50%, which is great, but we want to push up that number higher. But the thing that concerned me is so far amongst this sample anyway, we are seeing roughly a quarter of people who are saying that they don't have someone they feel confident at talking to about their mental health at university and in the workplace. And that's something that we need to continue to see if these findings are borne out as we go through the survey, but also investigate why and triangulate from this holistic approach when we're investigating with universities and workplaces as well. So just very quickly, I also wanted to highlight some initial results of expectations for the workplace. And so what we did is we asked a range of questions to students and those who are already employed with different tenses. So my education provides me, or my education provided me. And we're seeing some great responses, and that students and those in the workplace feel quite strongly or agree that they have been provided with the skills that they need for the workplace, which is great. There are some areas of change. So if we look at, for example, technology skills, this is something we need to look at more. Perhaps that's as a result of the COVID-19 cohort, where we're seeing that actually they feel that technology skills haven't been prepared by the university quite as strongly. And that's something we're going to investigate further. And so very quickly, I appreciate this is a canter through. What we have is mental health needs are a concern amongst this population. That is not in doubt. And we can see that confidence in speaking to someone is lower in workplaces and universities. And indeed in life, it's not quite as high as it could be. Students and graduates are suggesting that they do feel largely prepared for the workplace. And yet we have started interviewing HR teams. And this is a quote that I just wanted to highlight here. Now, it's perhaps a little bold and maybe a little exaggerated, But I have put here, as I think we really want to understand the possible suggestions that the cohorts transitioning to the workforce, they may be less prepared, and perhaps they're not as prepared in the way that they think for the workforce. And to be honest, as a result of COVID-19 and everything else, who wouldn't be? But I think it's important that we understand these challenges, and we want to know how best to support those who are transitioning during this time. So what's next is we would also very much like your help. So if you are able to participate in the survey and you graduated anywhere from 2020 or graduating in 2023, please do take our survey, and we would love to hear from you. Thank you very much.
Thank you very much, Zoe. I've posted in the chat. Please, if you have any questions to presenters, post them in the chat, and we will take all questions at the end of all presentations. We'll move on in the interest of time to the second talk by Professor Sylwia Jaworska. A brief introduction. I don't think that Sylwia needs introduction to most people here, as everybody would be quite familiar with her work. So Sylwia is a professor of language and professional communication at the University of Reading in the UK. And we're very lucky to have her as our expert on discourse analysis and corpus linguistics in our mental health projects. Her research is interdisciplinary, cross-linguistic and cross-cultural. And Sylwia's work on mental, so she's probably most known for her work on postnatal depression. And most recently, she's been involved in the project that Zoe just presented on. So she's a co-PI in the project. She leads the team in investigation of media representations of mental health in Hong Kong and Greater China. And without further ado, please welcome Professor Sylwia Jaworska.
Thank you very much, Olga. It's an absolute pleasure to be here with everyone this morning or this afternoon. So, yes, so people receive information about mental health from various sources, of course, but one of the most important are media, especially mass media. Media can influence how positively or negatively an issue is framed, setting certain discourses in motion that play a really important role in informing general beliefs, attitudes, understandings, and perceptions. And research has shown that ideas circulated in the media can be enabling and empowering. When, for example, representations of mental health are more positive or balanced, and this might, for example, in turn encourage a more open conversation and encourage people to speak up. Media representations can also be hindering when they are overtly negative, or even worse, when they are stereotypic and stigmatizing, which could then, of course, discourage or even silence talking about the topic altogether. Unfortunately, and for a very long time, media have tended to represent mental health problems in sensationalist ways, focusing strongly on individuals and extreme cases, and often using very pejorative vocabulary. Quite a bit of work has been done in counteracting such negative and stigmatizing representations. For example, a good example is the work by Mind Hong Kong, a charity which is working closely with journalists on devising guidelines on how to report on mental health issues and how to reduce the associated stigma. Our research is interested in identifying the ways in which mental health has been represented in media in Hong Kong and Greater China, where there has been actually quite little research on the topic, in contrast, for example, to research on mental health in the Western media. The few studies that exist on the topic actually point to differences in perceptions of mental health between the West and Asia, where more focus has been identified on more holistic and mind-body connections. And this has been contrasted with the rather biomedical or dualistic perspectives that often are emphasized in the Western media. Some researchers also suggest that the paucity of research in this area may perhaps have to do with the fact that mental health is perhaps more stigmatized in the Asian context than in the West. For the purpose of our research, we were interested in identifying the ways in which the global pandemic has affected media reporting on mental health in Hong Kong and Greater China. Today, what I'm going to talk about is just certain first initial stages of this larger project. For the purpose of this particular presentation today, we compiled 2 large corpora of news articles. So we are interested not just, let's say, in 5 or 10 articles, but larger selections. Our articles were collected from South China Morning Post, which is English-speaking newspaper. Our first corpus contains articles from 2018 and 2019, and we termed this corpus pre-pandemic. And the second corpus includes articles from 2021 and up to September of 2022. Although our second corpus covers a larger period of time, you will actually notice quite a rise in attention given to mental health issues. But what is really important for us is to find out how mental health has been represented and what has changed before and during the pandemic. To do so, we use the tools and techniques of corpus linguistics, specifically keyword analysis, when we compare our corpora with larger representative corpus of English language, such as the English Web 2020, which contains 30 billion words. For the purpose of this presentation, we're particularly interested in identifying the key items or the key terms that are used in our corpora as compared to this large reference corpus, because we felt that they will tell us something about the perspective, about the focus, and about the topic that have been emphasized. So we compared our pre and during corpora with English Web 2020, and our results have been normalized per 1 million words. So as you can notice, so the table which is shown on the screen right now shows you the key terms that came as significant in our pre-COVID corpus. And they tell us something about the discourse of mental health or around mental health. It's probably quite interesting, but possibly not surprising to see that young people have been identified as the main group. That's the group on which the reporting has been focused really. But it's not only just that any young people, but particularly those who engage in playing games. So gaming and gaming addictions was in the pre-COVID representations one of the most important or alarm-raising issues, and has been seen, again, social media and gaming have been seen as the main causes of mental health issues in the context of Hong Kong. What is also quite interesting is the fact that we had quite a lot of talk about ways on how to maintain mental health. And these ways were what we would normally describe as more holistic. Things, for example, such as meditation and yoga have been frequently reported in the media as a way to cope with mental health issues. When we are now moving on to our during the COVID corpus, not surprisingly, you will find a very different discourse. We still have young people as the main demographic group to which most attention has been dedicated, but you also find representatives from other groups. Domestic workers, migrant workers, elderly people, family members. Now it seems that social media, that mental health issues are actually affecting not just one chunk of a population, but really pretty much everyone. What is quite interesting as well, and it goes back to our focus on the large project in which I'm also engaged on trying to understand something about the graduate transition into the workplace and how this has been affected by the COVID pandemic. Here too, so in newspaper reporting, we find quite a lot of articles about university students and how university students has been really badly affected by the fact that, for example, they didn't have opportunity to engage with others through the social distancing measures, for example, through moving teaching online. The lack of social interaction has been emphasized as a really important contributor to the rise of mental health issues. For me particularly, who comes from outside of Hong Kong and Greater China, what I find particularly surprising was the keyword square foot. And when I engaged with the text, it was very clear that one of the issues that's been emphasized continuously in the media is the fact that often people live in a very little spaces, in a very crowded spaces, and that has been emphasized as one of the reasons why there has been a rise in mental health issues. So as you can see now, just as a way of summary, so in pre-COVID, there was quite a strong focus on mental ill health, and mostly it's an individual problem, really. And also a particular demographic group has been emphasized, that of young people and gamers. Holistic solutions have been really seen as the way forward. And for me, interestingly, there were no references pretty much to more of the sort of biomedical treatments like antidepressants that, for example, are frequently foregrounded in the Western representations. During COVID-19, mental health issues seem to obviously have affected any demographic group and across age groups and social status. Mental health issues have often been reported as post-traumatic stress disorders and seen as the consequence of the COVID-19 pandemic and the social measures that were required. Small and crowded spaces, issues related to housing were really reported as one of the major causes of mental health issues. There were quite a number of articles talking about students who had basically to live in a very crowded spaces. And as you can see, during COVID-19 pandemic, there's no more gamers. And in some ways, perhaps the people who are engaging in games maybe actually turned out to be a bit more healthier because they had still the opportunity to interact with the wider world. So the pandemic has shifted the focus from mental illness as an individual problem to mental illness as a social and societal matter that really requires social solutions. In our further research, we will consider representations of mental health in newspapers produced also in Chinese and widely distributed in Hong Kong and Greater China as well. We will compare the representations with media constructions in the Western context, that of the UK, to understand how mental health is constructed across different culture and linguistic contexts, and what kind of conditions and issues are emphasized. And more importantly, what kind of representations might act as enablers and which ones as barriers to help people speak up about their conditions and seek treatments. Thank you.
Thank you very much, Sylvia, for this wonderful talk. And this is really the research there's such a research gap in the literature, media representations of mental health in Hong Kong and Greater China. So we all are very excited about this project. Please post your questions to speakers in the chat, and we will take the questions after all presentations. Our next speaker is Stephanie Ngu, and it's my great pleasure to introduce her. We are very lucky to have quite a few people with psychology background on our research team, and Steph is one of them. So she holds a master's degree in clinical psychology from Columbia University in the US, and she's currently pursuing a PhD, which is fully funded by Mind Hong Kong and is one of collaborative ventures between HKU RIICH and Mind Hong Kong. So Steph's work with Mind focuses on the lived experience ambassador training, and she's working very closely with Mind Hong Kong anti-stigma team. Welcome, Steph.
Thanks, Olya, for that great introduction. Hi, everyone. My name is Steph, and the paper that I'm going to be sharing with you today is called, let me just present this. Sorry about that. There we go. This paper is called Exploring Forms and Functions of Mental Health Recovery Narratives and Their Implications for Narrator Wellbeing. And my co-author on this paper is Dr. Olya Zeit-Spence, who is here with us today. So in this first slide here is our lived experience ambassador cohort that we welcomed in May of 2022. And this was our recovery storytelling workshop that we held in that month. And lived experience ambassadors are people with experiences of mental health problems who choose to share their recovery narratives in order to combat mental health stigma in society. And they are the population that we focus on in our paper today. So first, I just wanted to touch upon why we've decided to look at recovery narratives for our research here. So recovery narratives are first-person narrations of one's experiences with mental health problems, and they are central components of contact-based interventions. And so what are contact-based interventions? These are anti-stigma efforts that facilitate interactions between people with lived experience of mental health problems and without lived experience of mental health problems. And the goal of these interventions is to help these people without lived experience to challenge discriminatory attitudes and beliefs that they might hold towards people with these conditions. And although the research suggests that this kind of intervention is one of the most effective ways to address mental health stigma in the community, at the same time, research shows that there are also risks involved in sharing recovery narratives for both storytellers and story recipients. And in particular, what we see from these studies is that language really does play a pivotal role in the safety and effectiveness of these storytelling strategies as a way of combating stigma in society. So, for example, how a narrative is structured or how issues within these narratives are framed by the storytellers can change how they impact the emotions and the perceptions of tellers and recipients. So despite this, a lot of the past studies have focused predominantly on identifying common linguistic features of recovery narratives, as opposed to looking at the functions of these features. That is how these types of linguistic features convey meaning that the narrator wants to share in their recovery narrative. Past studies have also examined the impacts of recovery narratives on predominantly on the recipients or the listeners of these narratives, and not so much on the storytellers themselves. And this is a really critical research gap because, as I mentioned previously, this kind of storytelling can be a very emotionally challenging and difficult activity for the person who's sharing the story. So what we aim to do in our research here is to examine how language functions in the recovery narratives, how meaning is conveyed as these storytellers share their narratives. We also aim to explore the implications of our findings for lived experience storytellers. So these are the people who are sharing their stories and their lived experience. So as a broad overview of what we found in our study is that storytellers used various narrative strategies to balance two key concerns as they shared their experiences. The first concern was to protect their psycho-emotional well-being, and the second concern was to frame themselves in an empowered and agentic light as they shared their stories. And I'll elaborate on these findings in the following slides. So the first key finding here was that differences in the degree of perspective alternations within a narrative can convey really important information about the storyteller's level of comfort with self-disclosure, with sharing details about themselves. So in this first excerpt, we see a narrative that is spoken from a sustained personal perspective, which we can see from the way that this person uses I statements throughout the narrative. As in, today, I would like to share my journey on growing up. I was a perfectionist. I believed I was only worthy of love. So when we look at this kind of sustained personal perspective throughout the narrative, this really does represent a great deal of comfort with self-disclosure because this person is identifying with the information that they're sharing throughout the entirety of their narrative. And it requires the storyteller to draw listener attention to their personal views and mental states. Conversely, in this second excerpt, we see alternations between perspectives as this person is sharing their story. So this person starts with, the lessons I learned was that, if anything, and the use of I here indicates the personal perspective. And in this next sentence, this person says, because humans, being social creatures, our interpersonal conflicts. And when they switch to this shared perspective, they're bringing in the audience members while also sharing something that they believe in, so our. And then finally here with this generalized perspective, you can try to make your life better for you. And notice here that the you here is the generic you form, which indicates that they're addressing anyone as opposed to a specific you in the audience in the immediate proximity. And so this serves a generalizing function. It's shown in also phrases like when we say you never know. So that's an example of a generic you form. And so these alternations in perspectives serve a distancing function because it's drawing attention away from just the person's perspective. It's showing that this person may not feel comfortable identifying with everything that they're sharing in this narrative, and indicates that this person might feel a sense of fear or apprehension toward perceived judgment from listeners after sharing sensitive information. And therefore, it can show a lower level of comfort with disclosure of certain details. Our second key finding was that storytellers would use evaluation statements in their narratives to emphasize the objective of their stories by drawing listener attention to points within the narrative that they wish to highlight. So an example of an evaluation statement is the take-home message from my story today is that if you're willing to do the work, there is hope and recovery. And when these statements are used, usually at the end of the narrative, the storyteller is able to draw listener attention to something that they hope listeners will remember and take away after they listen to the narrative, and therefore places this person in a position of agency because they're honing in on this particular point, asking the listeners to remember and to take this away after they've listened to the story. And finally, the third key finding was that recovery storytelling workshops serve a uniquely empowering and therapeutic function for lived experience storytellers. And this is because it provides this safe and non-judgmental space for storytellers to construct a narrative that allows them to frame themselves in an agentic and empowered way. And it also shows them that they're not alone in their experiences. And so this excerpt really nicely illustrates that. This person says, "It's really nice to hear everyone's story. Back then, when we're all experiencing our own struggles, we felt so alone. And then I realized now I'm glad I held out because I met people who understand and are supportive." So just to wrap up, these are our final points, the discussion and conclusion of our research here. We found that perspective alternations can reveal important information about a teller's level of comfort with disclosure. And the implications of this finding is that facilitators can use these linguistic cues to notice potential distress in storytellers and respond accordingly, provide support accordingly. A second key finding was that evaluation statements used within narratives can help draw listener attention to key messages and place tellers in an empowered position. And the implication of this finding is that facilitators can not just educate tellers on what to share, but more so how to share their narratives, on narrative strategies that can support effective communication and self-empowerment. And finally, we found that recovery storytelling workshops offer a uniquely empowering and therapeutic space for people with lived experience. And the implication of this is that it emphasizes the mutual benefit of these kinds of anti-stigma efforts for both recipients and tellers. And we really hope this research can help inform anti-stigma efforts going forward, particularly contact-based interventions, and support both tellers and recipients of these stories. Thank you so much.
Thank you very much, Steph. This is very much work in progress, and the data are absolutely amazing. So I'd like to invite our next speaker, Dr. David Edmonds. Doctor is another psychologist on the team, and we're very lucky to have him. So he holds a master's degree in psychology from Victoria University of New Zealand, and a PhD in sociology from the Chinese University of Hong Kong. He's currently involved in 2 projects with HKU RIICH team. He leads a project on mental health of end-of-life care workers, and he's also involved in the project that Dr. Fortune presented on at the start of the webinar on diverse impacts of COVID on university graduates transitioning to the workforce. So David will present on the first project. Welcome, David.
Hi everyone, my name's David, and today I'm going to be presenting on my first topic, as Olga said. This is just going to be a very brief overview of the findings that we have so far in the interests of time. So today I'm going to be presenting on sources of adverse emotions and mental health for end-of-life care workers during the COVID-19 pandemic. So studies show contradictory findings in regards to the emotions and mental well-being of end-of-life care workers. Some studies show that end-of-life care workers have quite high rates of things like depression and anxiety, But other studies find that there's really no difference between the mental well-being of end-of-life care workers and other kinds of healthcare professionals. There have been some reasons put forward as to why there might be higher rates of depression and anxiety in end-of-life care workers, such as the fact that they're having to deal with death every day, and organisational matters such as staff shortages and high workload. And of course, we're starting to get evidence now of the sort of increased emotional and mental difficulties that end-of-life care workers have faced because of COVID-19. So our interest is really in how do end-of-life care workers make sense of their emotions and mental health in relation to their work during the pandemic. So we have interviewed 21 healthcare professionals in the United Kingdom who worked in end-of-life care during the pandemic. And our analysis has focused on moments in these interviews where healthcare professionals talked about their emotions or described their mental health or their answers to questions when they were asked directly about their mental well-being. And our analysis through thematic analysis revealed one overarching theme, which was the sources of negative emotions and negative mental health, which is what I'm going to talk about today. So to start off with, we'll start by looking at some of the external sources. And just to summarize, there was uncertainty, organization and management, and what we call the limits of sociality. And I'll start by talking about uncertainty. Oh, no, uncertainty. Sorry, we'll go backwards. There we go. Oh, the uncertainty. So the uncertainty, obviously the pandemic was a very uncertain time, especially at the beginning of the pandemic. And the narratives of end-of-life care workers really reinforced this. So they would often talk about the stresses and their fears surrounding the uncertainty, not just of the disease itself, because remember at the beginning of the pandemic, we really didn't know much about the disease, but also the consequences. So what could happen to end-of-life care workers if they got infected with COVID? And now we'll move on to organisation and management. So this is another external source, and by external, I mean external to the person themselves. Now, end-of-life care workers often described negative emotions as the result of the actions of organisation and management. And by that, I mean people that were higher up or the organisation where they worked. So here in this brief quotation, we see an end-of-life care worker outlining their anxiety and their stress as a result of not having the necessary resources, namely PPE, that they needed to adequately care for their patients. And if we consider this level of the organisation, it's at quite a broad level. It's something that is the responsibility of both local health entities and nationally. And in these sorts of responses, what we saw in our interviews was that end-of-life care workers were outlining this, the cause of their adverse emotion as being organisation and management as a way of criticising their those who were above them. Now, the third external source that we have time to talk about today is the limits of sociality. And basically what I mean by this is the fact that the pandemic completely reshaped social behaviour and social interaction, especially in a healthcare context. So for example, nurses would often report their stress and anxiety as about having to enforce visitation rules. So for example, hospices and hospitals, some were only allowing maybe a couple of family members to come visit patients, or maybe some were not allowing it all. And nurses especially would really comment on the very difficult position that that put them in terms of having to enforce these policies on the ground. And healthcare workers really found stressful the coordinating final interactions between dying patients and family members that for whatever reason could not actually come in to the physical place. And so they were having to coordinate these final digital or technologized contacts in a very high stakes and high emotion setting. The final thing that I'm going to talk about today is a more internal source of adverse emotion. So something that was internal to the end-of-life care workers themselves. And this was the inner dissonance that they felt. So in this extract, the end-of-life care worker talks about the nightly clap for healthcare workers that would occur during the pandemic. And she also talks about the compliments that were given to her by her neighbors saying, oh, this is for you, this is for you. And that's the sort of tone that she used in our interview, in a sort of mocking tone, treating it as unwanted or condescending compliments. And so she details this dissonance. On the one hand, she had really support around her just from the public, but also this came into conflict with her emotions that she felt about going to work and how petrified I was of getting in the car and going to work. You wouldn't be clapping for me. And all of this leads to this guilt and complete guilt or dissonance that she felt. So some next steps. Of course, we also want to look at the positive emotions and mental health that end-of-life care workers experienced. End-of-life care workers did not always have a bad time during the pandemic. They often talked about the good times, especially around the support and the camaraderie that they had with their colleagues who worked in their workplace. We also want to do more of a cross-cultural comparison to the well-being of end-of-life care workers in Hong Kong. What might some of the differences be, and what could some of the cultural influences of those different experiences be? And just to finish off, I'd like to acknowledge Dr. Catherine Alder, Professor Jacqueline Yun and Professor Paul Wong for their insights and supervision throughout this project, and to all the participants, organisations and end-of-life care workers who gave their time and experiences during these interviews. Thank you very much, everyone.
Thank you very much, David. The last presentation today is on our collaborative project of mental health discourses in online support group for mothers during COVID-19. We've started publishing from that project already, and we just had a paper in Discourses Society if you're interested to find out more. So as all the presentations today have already highlighted, COVID-19 has resulted in a mental health crisis for every demographic group. So we were particularly interested in women, I suppose, as a bit of semi-ethnography, so having children and working through the pandemic, but also because we were driven by some of the reports that have suggested that women have suffered more during the pandemic than men, and that their initial deterioration in mental health at the start of lockdown measures was greater for women. There are a number of reasons that were put forward. Economic reasons, some scholars described pandemic as she-cession, furloughs, layoff, lost reduced productivity that affected women more, increased childcare responsibilities due to school closure, and the need to balance both work and home responsibilities. So if you think about the context of Hong Kong, that women who work and women who have children, they actually comprise quite a large proportion of the workforce, 50.8%. And there were a lot of setbacks. I suppose Hong Kong is notorious for how difficult it is for women to balance both work and children. So we have fairly inadequate childcare, very rigid workplace arrangement, and discrimination based on family status. In 2020, we conducted a survey in collaboration with City Mental Health Alliance Hong Kong and Oliver Wyman. And the survey that had quite a large number of respondents, 732, suggested that 1 in 4 people suffered from poor mental health during the pandemic. Women reported more severe mental health problems, and there were a number of stresses that were highlighted in the survey, including fear of contacting COVID, which was far greater for people with children under 10 years old, 71%, and childcare, which was a concern for 70% of people with children under 10 years old. So what we wanted to do is to see how these general trends outlined by the survey are reflected in more sort of qualitative data. We wanted to investigate the lived experiences of women in Hong Kong during COVID-19, but in particular with regards to their mental health. So we chose as our data a very popular online support group for mothers, which has over 64,000 members. So the English, the online support group medium is English, but you can see from the names of people that they come from diverse sociocultural backgrounds, which reflects the diversity of Hong Kong. And we've compiled a corpus of over 200 threads posted between January and July 2020. So I mentioned already semi-ethnography, so Zoe and myself were members of the support group. And once we've collected the data, we've done the usual thematic mapping and analytic mapping to see, which themes the members highlight with regards to COVID. So these are some examples of the threads that we've selected. So they all use some lexicon, some lexical items that denote a mental health state. So what was really interesting is that there were a lot of similarities, like striking similarities between our qualitative data of the survey and the quantitative data. The same common themes came up: fear of COVID-19, childcare, including homeschooling, and remote work arrangements. We used the concept of troubles talk in this work to examine the sort of conversations around mental health. And troubles talk is typically defined as portrayals of people's lives as undesired and warranting a change in behavior and perspective. But of course, during COVID, changes in perspective or any changes have been external, right? So and quite difficult to control. So I'll give you a couple of examples from the data. So this is very typical troubles talk by one of the participants, Sarah, who talks about, homeschooling being stressful and having to do the work, but also having to look after 2 kids. And what we've seen in our examples of troubles talk is that mental health talk is very much mitigated. None of that is serious. People don't talk about severe mental health disorders. People don't talk about, feeling suicidal or anything similar. So it's very sort of mild talk. However, it is still very much mitigated. So in this message in particular, we can see how the actual details of what Sarah is going through is backgrounded. And, it's included in the postscript of the message. But the actual message is about asking advice whether what she's feeling is normal. And throughout this message, Sarah seeks to normalize her experiences. So generally speaking, any troubles talk about mental health attracted a lot of comments. So this particular example with Sarah elicited 41 likes and 64 comments. And they all sort of care in responses. So they all express a sort of empathy and sympathy. And we organized these responses along sort of in 4 groups: assessments of Sarah's experiences, and every single assessment is, this is normal, what you're going through is normal, we're feeling the same. Reports of similar experiences, and I'll give you one example: compassionate statements, you're doing your best, we're all in this together. So this is very reminiscent of Hong Kong slogans, we fight the virus together. And advice giving, ranging from very brief advice, chill, she's only 5, stay sane, don't worry, to more elaborate advice. And some people really took, went to great lengths to make suggestions. So reports of similar experiences are very interesting. They're very brief, okay? And, they highlight the same the same troubles, feeling stressed and frustrated. The brevity of these messages could be attributed to the medium of communication. So these are online messages, but they also convey this idea of time constraint. I don't have a lot of time to type, right? And the same idea is conveyed by typos and contractions and elliptical sentences. I'm rushing through my message because I have to go and look after my children and do my work. There's quite a lot of humor, and some of the messages are really funny. And we are currently finalizing a paper on sort of talk surrounding drinking, but again, drinking not as an sort of heavier activity that these mothers are engaging with. It's all sort of around humor. So this joke by the member Cheryl is about a 4-year-old picking up the iPad and imitating his mother's behavior to go and do some work. Okay, so to sum up, and again, there is a paper that just came out that you can read more about this work. Striking similarities between quantitative and qualitative data. So quantitative data outlined some general trends. Qualitative data allowed us to look into the actual lived experiences of these women. So we could see the 2 omnipresent ideals of trying to be a good mother and trying to be a good worker. And arguably, it is the sort of the disjunction, the dissonance, and trying to balance these 2 ideas that caused these women's mental health struggles. So the concept of troubles talk is very useful in examining mental health data. But as I mentioned already, the troubles are external and they're a lot more difficult to fix or control. We've observed distinct grammar of mental health talk, specific lexical items, syntactic structures, and so on. So if mental health is so much stigmatized and people don't disclose sort of serious troubles, then why do these women go online and talk about it at all? And in this work, we argue that during COVID, these mental health support groups became really indispensable, because online communication became almost like the only way to talk to other people, the most proximate way of talking to people. So we think that as such, these online support groups are a very important platform of informal psychosocial support. And they should be given attention not by sociolinguists and discourse analysts, but also in mental health research and practice. Two methodological points that we make in our work is that these are not just interactions, they actually reach first-hand accounts of mental health. Sorry, my slides just disappeared. So they're very rich accounts, or first-hand accounts of mental health troubles. And the second point that we make in this research is about the convergence of psychology and linguistics. And this is what we've been trying to do in all our projects. So in psychology, there is an increasing call to investigate lived experiences. And Stephanie's presentation before presented some work on that. But in linguistics, we've got very well-established tools, right? We've got the whole approach, narrative inquiry, and bringing these two together can actually be very, very productive. Thank you very much. And I'm sorry for the slides that disappeared in the end. I would like to pass on to Adil, who is our discussant, to sum up the talks and the work that's been done by Hong Kong U RIICH, but also to take questions. Thank you.
Perfect. Thank you very much, Olia. So definitely, if you have any questions, please pop them into the chat box. We're going to overrun by a few minutes. So if you can stay with us, please do. So thank you, everybody, for presenting your work. It was really meaningful for me to hear about everything that's going on. I know I'm involved in a few of the projects, but it was really nice to have this culmination of work and seeing sort of a few themes really come together and crystallize as you guys were presenting, thinking about language and narratives of both of lived experiences, but it's such a depth and breadth of people with lived experiences, whether it's individuals who are, with diagnosable mental health conditions, or students and new grads going into the workplace and understanding their experiences, individuals who are working within the healthcare system and going through the difficulties of COVID and understanding their lived experience. I think this understanding, and of course, mothers during this time, I think I heard it last week, women are the shock observers of the world. And so understanding what they've been going through during this time. The other theme that came out was really the anxiety around COVID, particularly in the workplace, whether it was new grads or healthcare providers, and understanding those anxieties. And of course, some of it was touched on by Olga's work, looking at women and how that dichotomy of being a care provider as well as being a worker, and how do you balance those two things. So I'm seeing one question so far. So the shift from individual to societal factors of mental health challenges during the COVID-19 pandemic is interesting. What might be the hypothesis surrounding the mechanism of this shift? So I wonder if I can, Zoe, I'm going to put you on the spot because there's quite a lot of shifts that you're looking at. When we're kind of thinking about the COVID pandemic, if you want to kind of think about how is this impacting the work that you're doing?
Yeah, thank you. And I think it's a really interesting question. I'd be interested to hear from the other speakers from their angles as well. I think what's happened globally and within Hong Kong, we need to look at a global level, and we also need to look at a local level. And by local, I mean within a workplace, within a healthcare setting, within a school, within a university, as well as within Hong Kong, as well as within globally, because we've got a societal response to COVID, whether that is lockdown, whether that is quarantine measures, whether that is societal restrictions, and then we've also got the individual response to those restrictions and how people interact with those as well, and how people, whether it's that they're spending more time at home, or whether it's their workplaces are offering a 3-day come in the office for 3 days and they're feeling safe around that, or whether they're not feeling safe around that. There are so many individual factors that I think that we need to take into account in the research. And that's why I'm really excited actually about the research that we're doing, which also has a qualitative component to actually explore, well, for example, from our perspective, if your workplace, does your workplace make you feel safe? How do you conduct your work? What does it mean if you then go back into another lockdown? This fear that you just talked about, Odile, in terms of actually the anxiety hasn't left us. We're still grappling with this, and we recognize that this might continue into the future. So from our perspective, how can we ensure, we can't measure every variable, but how can we try and understand the impact of societal factors during COVID-19, the way people responded to those, and the individual factors? I hope that answers the question, but I'm really interested to hear everyone else's perspective.
Yeah, and I think, thank you very much, Zoe. That was really, really helpful. And then Sylvia, if I can bring you into the conversation, because of what you have seen from the media research, because you really saw this going from a very kind of individualistic lens to something a little bit more societal, more structural, kind of looking at the media. So Sylvia, if you can give your 2 cents.
Yes, obviously I can only kind of talk about things from the sort of media perspective and what kind of issues were emphasized in the media reporting. But I think that in general, I think there's been quite a large focus on mental health as a kind of particular mental health problems and conditions as, you know, problems because of individual kind of maybe some imbalances in the brain and so on. And in some ways, I think that also kind of goes back to the very neoliberal kind of discourse that, you know, that's your problem. And if you have a problem with mental health, then, you know, that's your problem. You have to own the problem. You have to do something about it, and kind of, you know, removes responsibility from other actors, agents, social state in particular, you know, the state as so on. Yeah, so you just do a bit of yoga and meditate, and, you know, you'll be fine. Yeah, and don't do any gaming online, really. Okay, so I think that's been kind of, you know, that kind of perspective, mental health issue. But I think the social issues have always been there. This is because we were going through sort of fairly, you know, comparatively peaceful times without, you know, there was the financial crisis and so on. There were some other disruptions, but in general, you know, people were not affected, like everyone, you know, affected by something like this major disruption, this major crisis. And I think it's because of this crisis, these things actually, they've been always there. They came to light much more strongly, I believe. So I think, in a sense, I feel it's a good outcome, because, you know, while mental health issues may be kind of down to the individual, lots of issues are basically because of the kind of social conditions in which people live and work. And I think we need to look into the social conditions and try to basically, you know, press for some changes and so on. Yeah. So I feel that the issue has been always there. It's just the pandemic is just, you know, brought it to light really quite sharply as well, because all of a sudden, you know, there were not the usual youngsters and gamers. Everyone seemed to be affected, you know, by mental health issues. And our survey has shown that also very clearly.
Yeah, absolutely. And I think, you know, you bring out a really good point. You know, the social structures have always been a huge impact on our mental health. It's not just genetics. You know, it's not just our psychology, but social structures are really important. And we've never before, sort of in the history, I want to say it, like, of our society, at least as I know it, have been impacted where it's like every single human on the planet has been impacted. We're not all impacted in the same way. Of course, a lot of us have privilege in different ways, but I think all of those, that privilege and that inequity has been really highlighted by COVID, because it has impacted literally everybody, every country, every sector. And then we were able to see sort of who managed better, who managed less
precisely,
well.
Because of the social conditions in which you were, precisely as you said. I think that's a really important point. Yeah, absolutely.
Thank you. And then Stephanie, have you seen any kind of shifts working with individuals with lived experience with mental health conditions? Have you seen any shifts between, you know, kind of pre and post COVID?
Yeah, I think people, and Odile is one of our co-facilitators for the recovery storytelling workshop. So we both really seen, I think, during COVID or kind of post-COVID, we were looking at this isolation. I think isolation was something that a lot of people brought up, and working from home. That was something that a lot of people were talking about, you know, just grappling with the changes, the uncertainties during COVID. So I think just to the point of how we've taken kind of a more societal focus as opposed to an individual focus, I think largely because a lot of people are impacted in various aspects of their daily lives. And that's made it especially evident that mental health, everyone has mental health. Not everyone may experience a mental health condition in their lifetime, but everyone is becoming increasingly aware that everyone, you know, in everyday life, we will encounter these challenges or difficulties that can impact our sense of psychological well-being. So I think that's the reason, or one of the reasons why there is a more widespread awareness of the concept of mental illness and greater discussion and emphasis placed on it at a societal level.
Great, thank you. And bringing David into the conversation as well. So your work was really resonant to me. I myself came very much from a bedside background and can understand sort of the anxieties of the frontline workers, you know, as well as a lot of the good things that they've gotten from this, but definitely the anxieties. What do you think are the shifts that you have seen through your research? And I wonder if you can like hypothesize a little bit. I know your research was, I think you said it was in the UK, and kind of hypothesize like what you're going to find in Hong Kong, because I have some ideas, but if you can kind of talk us through sort of like what are some of the shifts that you've heard from your work.
Yeah, I think, so just to focus on the first part of the question, I interviewed people in the UK, and we've interviewed people in Hong Kong. So to start with the UK, we've really seen a shift because we started interviewing them as the pandemic has started to supposedly end in the UK. And we really saw kind of two aspects of mental health. This idea that mental health is now something that is much more talked about in the open in the workplace, much more acknowledged by not just workers themselves, but also by the organizations and management. And the second thing that we really found with regards to mental health and coming out of the pandemic was this staying in place of many of the things that organizations had done during the pandemic to promote and foster support for mental health. They were just staying there and they were going to sort of continue. So I think those are both very beneficial. The idea that, you know, now we're much more aware of mental health, and what we've done during the pandemic, we're going to keep it in place for the long run, hopefully, to ensure that our workforce are still well supported and still mentally healthy. On the second part of the question, what do we start to see with some of Hong Kong? Well, we haven't compared all of our data yet, but we found that a lot of Hong Kong, a lot of the difference in responses to the pandemic were seen in how people felt as well. So obviously the UK had a very strict lockdown. People couldn't go to work, but healthcare workers could go to work. So they felt, obviously they had a lot of negative stresses because of the pandemic, but they also reported that, you know, going to work was quite liberating in a way. Something similar in Hong Kong, different context in Hong Kong, insofar as we never really had those lockdowns. So people's work has they've always been working, but they've been more affected by the restrictions and how that has limited their interactions with the patients. So they haven't really talked about like being happy because of a return to normalcy, because they've always been going into work. But for them, it's more these sort of long-term restrictions have really put a strain on them and their mental health.
Great, thank you. And Olya, if you want to just sign us off, any kind of final thoughts for you. And I just see, sorry, Zoe just put up a link to our survey. So if there's anybody out there who fits our criteria for newly graduated or just finishing up school, please do our survey. So Olya, any kind of final thoughts from you?
Thank you very much, Adil. First, I would really like to thank everyone who attended the webinar. We look forward to any of the comments that you may have. Please get in touch with us. So the survey is online, and I believe Vincent will post now the information about Hong Kong U RIICH website as well. We've been very fortunate at Hong Kong U with sort of an opportunity to collaborate with two major non-for-profit organizations in Hong Kong, Mind Hong Kong and City Mental Health Alliance Hong Kong. They've been a huge part of all the work that we've been doing, and we look forward to further collaborations with these two organizations. If there is any similar work, I know that there are quite a few students who signed up for the webinar, but if you're aware of any similar work that people are doing internationally, we would absolutely love to hear from you on any of the projects that we've highlighted today. And we're very fortunate to have our ongoing collaboration with IC4CH. So thank you, Diana, for being the driving force behind IC4CH. And we look forward to the next webinar that will take place in early November.
Can I be a little bit cheeky and say, first of all,
yes. That was my point, to invite you to announce Diana.
Oh, sorry, Ollie, I didn't mean to interrupt. I just wanted to say what a wonderful, beautifully organized webinar, but I learned so much about it, and I have so many questions, but it's getting very late here, and I thought the people, there was lots of other people wanting to ask questions as well. So I'll follow up with you, Ollie, afterwards with all my questions I have, but it was wonderful, beautifully presented, and I am very, very interesting work, and very interestingly cross-disciplinary work. Can I just put a little bit of a plug in for our International Symposium for Communication in Healthcare? We, IC4CH, have been running these for quite a few years, but the earlier iteration, we actually started this kind of early iteration of this in 2010 with wonderful colleagues, including Jack Pun, who I know is here at the moment. I think Angela Chan might be as well, etc. So the next one is at ANU in Canberra, the 14th and 15th of February. We're trying to make it hybrid, but it's definitely going to be face-to-face. The reason why they're pretty, I think so, I think Ollie will agree, that we don't to call out for abstracts. So it's a smaller group. It's usually only about 100, 120. Most people attend the 2 days in the same room. So you build up a wonderful atmosphere of everyone listening to the same papers. People come and go, of course, with other commitments, but on the whole, most people stay. And we have drinks after day one, and I'm trying to entice you, you can see, and a dinner on the second day. So you're all welcome. We will, and I'll send Olya the save the date. We will send out the information, and I don't know whether I've got access to this, to the participant list, because I don't know whether that's allowed, but if so, I'll send you that detail. Please, everyone, think about it. Come to Canberra, time to be back face to face and enjoy each other's company and hear about great work. And thank you for this webinar, and thank you for letting me put a plug in, Olya.
Yeah. Thank you very much, Diana. So on this note, I think we will finish our webinar. But this is not a goodbye. I mean, I'm being very stereotypical, but we do look forward to hearing from you and meeting you at other events organized by both Hong Kong U RIICH and IC4CH. It's indeed an absolutely wonderful collaboration. Thank you all.
Thanks, guys. Bye.